Look, Bumble knows you're exhausted by dating. All the must not take yourself too seriously and 6'1" since that matters. And what do I even say other than hey? Well, that's why they're introducing an all-new Bumble with exciting features to make compatibility easier, starting the chat better, and dating safer. They've changed, so you don't have to. Download the new Bumble now.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steyer, a public health scientist, and today I'm joined by general pediatrician Dr. Dina DiMaggio. Okay, so today we're going to talk about ADHD medications. The clock is ticking, so let's get to it. All right, so there have been shortages of multiple medications lately, including medications to help treat ADHD in children. So let's discuss ways to help, what you could do if you can't find your child's medication in stock. So Dina, first, how common is ADHD and what is it?
So ADHD is really quite common and affects about 9.4% of U.S. children aged 2 to 17. To break down a little further, it affects 2.4% of children ages 2 to 5. And 4 to 12% of school-age children. Boys are more than twice as likely as girls to be diagnosed with ADHD. ADHD is diagnosed when a child shows signs of inattention, hyperactivity, and impulsivity. So signs of inattention are seeing that your child has a hard time paying attention, is easily distracted from work or play, is disorganized, forgetful, avoids tasks that require a lot of thinking. Signs of hyperactivity are the classical child that gets up in the middle of class and can't sit still, fidgets a lot, is in constant motion, and it's hard to sit still. Finally, the signs of impulsivity may include speaking out randomly, trouble taking turns, and interrupting others. The symptoms included may also have learning and language problems, and not all children have all the symptoms. It's best to go to a psychiatrist or healthcare provider that can make the formal diagnosis to get your child the help he or she needs.
Thanks, Dina. And on a personal note, and I think I've shared this previously, my son, who's 7.5, he was recently diagnosed with ADHD. So this definitely hits home for me. So what is the treatment of ADHD?
So it involves a long-term plan with goals for behavior, follow-up, and long-term monitoring and adjusting treatment. Kids often need counseling, behavior therapy, and some may need even medications. But of course, we don't jump to medications as a first line.
So then what can parents do if their child needs medication but can't get it?
So you're definitely not alone. There has been an ADHD medication shortage starting in the fall of 2022, and it's still ongoing. Of course, first talk to your doctor about alternatives. Brand name prescription drugs such as Adderall XR, Vyvanse, and Focalin all have been hard to find. So you may talk to your psychiatrist about switching to a longer or shorter acting version of the same drug, take a different drug that is just as effective, or try a generic version of those medications.
So then what if the medication has gone up in cost?
So you want to talk to your pediatrician or psychiatrist about switching to a generic version, or if you have prescription drug coverage, check to see what medications in your plan are in fact covered. Your pharmacist would also be helpful with this, or may know of ways to get coupons to help cover the cost.
So can you explore other ways to help with symptoms?
Sure. So additional ways may not replace the medications, but may be part of an overall strategy. So you can explore behavioral treatment, which helps to improve your child's behavior and self-control, and has evidence for helping symptoms in kids 12 and under. This usually involves reward strategies and also consequence strategies. You can talk to your child's school if there are supports available, such as meeting with a counselor, frequent check-ins with teachers, or specialized education with individualized education plan or IEP. Also helpful is spending time outdoors, which can ease ADHD symptoms. Spending time outdoors has research supporting improved concentration and focus. There's also some research that kids may benefit from mindfulness activities like meditation and yoga.
All right. Well, I learned something. I hope you learned something, and we have lots more to share. You can get your bite of health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple, and please be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
If you like this podcast, can we recommend another one? It's called Big Picture Science. You can hear it wherever you get your podcasts, and its name tells part of the story. The big picture questions and the most interesting research in science.
Seth and I are the hosts. Seth is a scientist. I am Molly, and I'm a science journalist. And we talk to people smarter than us, and we have fun along the way. The show is called Big Picture Science, and as Seth said, you can hear it wherever you get your podcasts.